Hi, my name is Rafael Matoso. I'm a student at the School of Medicine of the Federal University of Juiz de Fora in Minas Gerais, Brazil. I'm going to present a study that we conducted named Smoking in Times of the COVID-19 Quarantine, a Systematic Review. Brazil is one of the most affected countries by the COVID-19 pandemic, with the second largest death toll at the moment. Secondary impact in mental health and smoking behavior are an emerging concern. With this current review, we aim to assess if smoking behavior changed and any psychopathological effects on smokers since the beginning of the quarantine. In order to conduct this systematic review, we used the PRISMA methodology, the PICO strategy, and the databases PubMed, ScienceDirect, and Cochrane Library. The research date was April 16 of 2021, and the keywords were novel coronavirus and quarantine and smoking behavior. This is the data extraction spreadsheet, and we identified 28 potentially relevant references with a final database of 8 papers and a sample size of 22,928 participants. As for the results, the smoking behavior got worse in 6.9% of the interviewed smokers, with a decrease in smoking in only 3.4% of the interviewed smokers. The desire to quit smoking since the COVID-19 outbreak was related with diabetes and perceived risk of severe infection. Currently, smoking was related to a higher risk of depression, anxiety, and stress symptoms. Smokers were more prone to suicidal ideation and had a higher fear of COVID-19, which was assessed with a validated scale. So, smoking is undoubtedly one of the most serious global public health problems, aggravated in middle and low-income countries, where 80% of the world's smokers resides. In those countries, smoking has also been associated with higher levels of stress. With the results of the association of smoking and higher levels of anxiety, depression, and stress, we can conclude that the problem is extended to both a psychiatric disease epidemic and the aggravation of smoking. In this manner, the addiction can be intensified by stress, as the mental health problems are worsened by the addiction itself. Some studies have associated smoking and worse outcomes in COVID-19. And with studies reporting a negative change in smoking behavior during quarantine, the current scenario can evolve with even more damage to smokers' health. It is imperative to conduct more studies on smoking behavior and the psychopathological impact on smokers during quarantine. This data should be used to propose urgent public health interventions. Thank you for your attention.